There's a growing number of seniors in the United States who are desperately trying to hold on to their mobility, skin elasticity, and quality of life. But many don't know that one of the most powerful tools they could be using is collagen. This protein, naturally produced by the body, is what keeps skin firm, joints flexible, and connective tissue resilient. But after age 50, collagen production can drop by more than 50%, and the decline continues every year. Wrinkles deepen, joints ache, skin sags, and ligaments become less elastic. Seniors from the United Kingdom, Canada, and Australia are also noticing the same changes. And it's not just about aging, it's about collagen loss. Collagen isn't just a cosmetic supplement, it's a structural protein that literally holds the body together. Yet the vast majority of seniors are not using the right type or dose, and many are simply taking products that don't even work. The United States market is flooded with collagen powders, pills, and drinks, but most people don't know there are at least 16 different types of collagen in the body, with type 1, 2, and 3 being the most critical for aging adults. Type Y makes up around 90% of the body's collagen. It's the one responsible for skin, bones, tendons, and ligaments. Type 2 is mainly in cartilage, and that's the one that helps with joint pain and flexibility. Type 3 supports the structure of organs and blood vessels and helps skin remain firm and plump. The sad reality is that many popular collagen products, being sold on Amazon or in drugstores across the United States, contain hydrolyzed collagen peptides that are either low quality, underdosed, or missing key cofactors needed for proper absorption. Seniors end up wasting money, seeing no results, and assuming collagen just doesn't work for them. But the truth is, it does, if it's the right type, in the right form, with the right support nutrients. Let's take the example of a retired couple from Arizona in their early 70s. They were both dealing with chronic joint pain, knees, hips, and shoulders constantly stiff. They also noticed their skin had lost its elasticity, with deep lines appearing around the mouth and eyes. After trying various over-the-counter creams, they stumbled upon a collagen supplement with type 2 collagen, derived from chicken sternum. After about 8 weeks of consistent use, combined with vitamin C and hyaluronic acid, they noticed less stiffness in the morning, more fluid movement throughout the day, and even subtle improvements in skin texture. This kind of transformation isn't rare. It just requires a little knowledge about which collagen types are best for seniors and how to use them. Type 2 collagen for joint health has shown especially strong results in clinical studies. In one randomized, double-blind study from the United States, adults over 55 who took undenatured type 2 collagen daily saw significant improvements in joint comfort, mobility, and flexibility. The results were far more impressive than the group taking just glucosamine and chondroitin. That's because collagen doesn't just cushion the joint, it helps rebuild the cartilage itself. But here's the critical part that most people don't understand. Collagen needs to be taken consistently for at least 8 to 12 weeks before noticeable benefits appear, especially for joint pain and skin elasticity. Many seniors stop too early, thinking it's not working, when in fact, their bodies just need more time to integrate the peptides into the tissues. The combination of collagen with vitamin C is non-negotiable. Vitamin C is essential for the enzymatic process that allows your body to synthesize new collagen. Without it, collagen supplements won't be fully effective. That's why top-rated collagen supplements for seniors in the United States usually combine hydrolyzed collagen peptides with ascorbic acid or a buffered vitamin C form. It's also important to mention that collagen from marine sources, like fish, tends to have higher bioavailability, meaning the body absorbs it more easily than bovine or porcine sources. Seniors who struggle with digestion or have sensitive Stomachs often report better results with marine collagen, and the added bonus is that it's usually type 1 collagen, which is ideal for skin, hair, nails, and bones. There's also a growing trend in the United Kingdom and Canada where seniors are turning to multi-collagen supplements that include types Y, T3, the 3, V, and X. These blends cover a broader spectrum of benefits, not just for skin and joints but also for connective tissue and gut lining. When seniors pair this with collagen boosters like hyaluronic acid, MSM, methylsulfonyl-methane, and silica, they report faster recovery from injuries, reduced joint inflammation, and improved skin hydration. Some of the top-reviewed products in the United States even include digestive enzymes to improve collagen breakdown and absorption, making it easier for older adults who may suffer from low stomach acid or slowed digestion to get the full benefit. Collagen is not just something that should be reserved for beauty routines. It's becoming a key part of longevity protocols, especially for aging adults in the United States who want to remain active, pain-free, and vibrant. If a senior wants to play with their grandchildren, walk without limping, or avoid the dreaded knee replacement surgery, collagen needs to be part of their daily routine. And yet, many doctors don't bring this up during appointments. Why? Because it's a supplement, not a prescription. It's not something covered by Medicare. But that doesn't mean it's not powerful. Seniors are often left on their own to research, to test different brands, and to hope for the best. But the right information changes everything. In Australia, many older adults are also choosing collagen after years of taking NSAIDs and realizing the damage these painkillers can do to the stomach and kidneys. Collagen, especially when paired with anti-inflammatory nutrients like turmeric and boswellia, provides a safer, long-term strategy for managing chronic joint pain. What's even more powerful is that collagen doesn't just mask pain like medications. It helps restore the EHB, structural integrity of the joints. In studies, MRI imaging has shown actual increases in cartilage density after consistent collagen use. That means it's not just symptom relief, it's real regeneration. There's another key factor that cannot be ignored: collagen dosage. Many people are simply not taking enough. Research has shown that daily doses of 10 to 15 grams of hydrolyzed collagen peptides are necessary for significant results in skin elasticity, joint support, and bone density. Yet countless supplements in the US market only provide 2 to 3 grams per serving. That's nowhere near enough. And when seniors think it's not working, they're often just underdosing. Brands that are transparent about dosage and sourcing, especially ones made in FDA-registered facilities in the United States, tend to be more trusted by seniors, especially those looking for high safety standards and quality manufacturing practices. Some of the most powerful emotional testimonials come from seniors who felt invisible and hopeless before they found the right collagen supplement. One woman from Texas shared how she couldn't open a jar or go up the stairs without pain, and her skin had begun sagging so much that it affected her self-confidence. After 3 months of taking a marine collagen powder with added vitamin C and hyaluronic acid, she said she not only looked younger, but she felt like herself again. Stronger, more confident, and even more social. She had started going to weekly line dancing classes again. These are the kinds of results that change lives, not just appearances. Another senior from Florida described how he had been avoiding golf games with his friends because of his stiff shoulders and knees. After starting a supplement with a blend of type 2 and type X collagen, along with MSM and turmeric, he reported that the pain gradually faded and he regained full range of motion. He was not only back on the golf course, he was also sleeping better, which surprised him. Collagen has also been shown to improve sleep quality, likely due to its role in reducing inflammation and supporting neurotransmitter balance. Seniors in the United States, more than in any other country, are dealing with overlapping health issues like insomnia, joint pain, and skin aging, and collagen touches on all of those. Many older adults are also unaware that collagen supports bone density. This is especially important in the postmenopausal phase for women, who are at much greater risk of osteoporosis. A well-structured collagen protocol, including calcium, magnesium, vitamin D3, and vitamin K2, can help maintain stronger bones and reduce fracture risk. Seniors who have been diagnosed with osteopenia or early-stage osteoporosis are turning to collagen as a non-pharmaceutical approach to protect their bone health, particularly those who are wary of bisphosphonates or other strong medications often prescribed for bone loss in the United States. In many parts of the United States, aging adults are beginning to realize that bone fractures from simple falls are one of the leading causes of disability and loss of independence. What makes this even more frightening is that many of these fractures could be preventable if the bones were stronger and more supported. Collagen, as it turns out, is not just a skin-deep supplement. It forms the protein matrix that gives bones their flexibility and strength, making calcium and minerals adhere better to the bone surface. Without collagen, bones become brittle, and brittle bones break. Even seniors with good calcium intake and vitamin D levels might still suffer from fractures if collagen is deficient. That's why many healthcare providers in Canada are now recommending multi-nutrient protocols that center around collagen as a foundational part of bone health support. What's often misunderstood is how collagen supplementation is different from just eating protein. Many seniors assume that drinking a protein shake or eating more meat will provide the same benefit. But collagen is made from specific amino acids like glycine, proline, and hydroxyproline, which are not found in high amounts in standard protein sources. These amino acids are crucial for regenerating the tissues that decline with age: skin, cartilage, ligaments, and even arteries. Seniors who are already on a high-protein diet may still have low collagen levels if they aren't consuming collagen-rich foods like bone broth or using a supplement. And realistically, not everyone wants to drink bone broth every day, which is why high-quality collagen powders or capsules have become such a staple for aging adults in the United Kingdom and Australia who want easy daily support. There's also a huge misunderstanding around how quickly collagen supplements can work, especially for seniors dealing with skin sagging and joint pain. Some expect results in a few days, but the clinical research paints a more realistic picture. Most improvements become visible or noticeable around the 8 to 12-week mark. That means a full 2 to 3 months of daily use before skin begins to firm, fine lines smooth out, or knees stop cracking during simple movements like getting out of a car. It's frustrating to wait that long, but it's the reality of how the body rebuilds tissue. Seniors who commit to the full 3-month protocol almost always report better results than those who quit after a few weeks. And the truth is, results often continue improving even after 4 or 5 months of use, especially when other lifestyle factors, like staying hydrated, avoiding smoking, and limiting sugar intake, are part of the plan. In several real-life cases across the United States, seniors who had previously been relying on steroid injections or anti-inflammatory medications began phasing them out after committing to a high-dose, high-quality collagen supplement. In one case, a woman from Ohio had been receiving corticosteroid injections in her shoulders every 3 months due to chronic inflammation from arthritis. These injections were painful, expensive, and losing their effectiveness. Her son suggested she try a supplement that combined type 2 collagen with hyaluronic acid and boswellia extract. 3 months in, she noticed she hadn't scheduled her usual injection, and she didn't feel the need. She could lift her arms more freely, reach overhead, and even carry groceries without the familiar sharp ache. This isn't just anecdotal. Clinical research supports the reduction in inflammatory biomarkers with consistent collagen use, especially when combined with naturally anti-inflammatory compounds. Another aspect that seniors rarely consider is how collagen impacts gut health. With aging, the gut lining becomes more permeable, which can lead to increased inflammation, food sensitivities, and nutrient malabsorption. Collagen contains the amino acid glutamine, which is essential for healing and maintaining the integrity of the intestinal wall. Seniors who suffer from bloating, gas, constipation, or irritable bowel symptoms often notice digestive improvement after just a few weeks of collagen supplementation. In the United Kingdom, some aging adults have reported that daily collagen intake reduced their dependence on antacids and over-the-counter digestive aids, which can have long-term side effects when overused. The emotional component of aging, especially in terms of appearance, is another powerful reason why seniors are turning to collagen. Skin aging is not just cosmetic. It deeply affects confidence and mental health. When an aging adult looks in the mirror and sees deep wrinkles, sagging jowls, and hollowed cheeks, it can contribute to depression and social withdrawal. In Canada, seniors participating in clinical studies of collagen supplementation reported not only better skin texture and elasticity, but also higher self-esteem and mood improvement. Feeling good in your own skin is not a vanity issue. It's a mental health issue. When someone feels better about their appearance, they're more likely to socialize, exercise, and stay engaged with their community. This alone can improve health outcomes dramatically. It's also important to mention how collagen affects hair and nails, which can also thin and weaken with age. Seniors, especially women post-menopause, report increased hair loss, thinning, strands, and brittle nails. This is often linked to hormonal changes, but collagen loss plays a massive role too. Supplementing with collagen peptides that include types Y and 3 can result in stronger, shinier hair and nails that don't break as easily. In Australia, beauty clinics that cater to the 60-plus age group are now recommending daily collagen drinks, not just for skin tightening but also for improving hair fullness and nail strength. The psychological impact of regaining fuller hair or nails that actually grow can't be overstated. It gives a sense of youth and vitality that many seniors thought they had permanently lost. For seniors in the United States living in care facilities or retirement homes, collagen supplementation can also contribute to improved mobility and fewer injuries. When mobility increases, risk of falls decreases, and seniors stay independent longer. Studies show that collagen helps strengthen the tendons and ligaments around the joints, which makes movements more stable and reduces the chance of awkward twists or stumbles. Fall-related injuries are one of the biggest health threats to seniors in the U.S., often leading to hip fractures that require surgery, rehab, and in some cases, result in a permanent loss of independence. Anything that strengthens structural tissues and supports balance is worth taking seriously, and collagen has a direct role in this. There's also an increasing number of integrative physicians in Canada and the United States who are beginning to include collagen as part of post-surgery recovery protocols. After orthopedic surgeries, like knee replacements, hip repairs, or spinal fusions, collagen can support the healing of connective tissues, speed up recovery, and help reduce scar formation. Some surgeons are now recommending patients start collagen supplementation weeks before their procedure and continue it for several months after. It's a simple step that could reduce the time spent in physical therapy and improve long-term surgical outcomes, especially when combined with rehab exercises and physical therapy. Seniors who are preparing for or recovering from surgery should ask their healthcare provider about integrating collagen into their regimen, but not all collagen supplements are created equal. Seniors need to be cautious about additives, artificial sweeteners, and untested sourcing. Products made in GMP-certified FDA-inspected facilities in the United States are generally safer and more rigorously tested. Look for grass-fed, pasture-raised bovine collagen or sustainably sourced marine collagen that comes with third-party lab testing. Avoid supplements with unnecessary fillers, preservatives, or cheap ingredients. Transparency in labeling and sourcing matters, especially when dealing with an older population that may be on multiple medications or have specific dietary needs. Many high-quality brands in the United Kingdom and Australia are now making allergen-free and flavorless collagen powders that can be mixed into coffee, smoothies, or even soup, making daily use more convenient. Hydrolyzed collagen peptides are generally the most bioavailable form, meaning they're already broken down into smaller chains that the body can absorb easily. Seniors who struggle with digestion or have slower metabolic rates benefit from this pre-digested form, which can be taken without needing a complex digestive process. Many US-based supplement companies now offer collagen blends with added cofactors like vitamin C, zinc, and copper to support collagen synthesis within the body. Zinc and copper are essential trace minerals that work as cofactors for enzymes involved in collagen cross-linking, which determines the strength and structure of newly formed collagen fibers. Without these nutrients, collagen production remains incomplete or weak. Even water intake plays a role in how effective collagen supplementation is. Collagen attracts water molecules to itself, helping to hydrate the skin and maintain elasticity. Seniors who are chronically dehydrated, something surprisingly common in the United States, may not see optimal benefits unless they increase their water intake. Hydrated collagen fibers are more elastic, more resilient, and better able to resist damage from free radicals and mechanical stress. Seniors need to be drinking more water if they want to see results in their skin, joints, and connective tissue after starting a collagen regimen.